All right, today we are diving into the Atlanta Health Review by Ariana Lyons. And it's a really fascinating look at a city of contradictions, a place that's a global leader in medicine, but at the same time is dealing with a pretty massive public health crisis.
Okay, so let's just jump right in. This really lays out the whole paradox, doesn't it? On one hand, you've got Atlanta as this medical powerhouse. I mean, home to the CDC, world-class hospitals like Emory and Grady, a real hub for innovation. But then you look at the other side of the coin, an uninsured rate that's higher than the national average, these so-called medical deserts right in the city, and just staggering disparities in health outcomes. It's literally a tale of two cities.
And that really brings us to the central question of this whole review, right? How can both of these things be true at the same time? How can a city be a beacon of medical excellence and also a place with such deep, profound health inequity? We're going to use the data from the review to really try and understand what's going on here.
And this quote from the author, Ariana Lyons, just hits you right in the gut. You can live a mile from a world-class hospital and still not be able to afford a flu shot or a prenatal visit. Wow. That just cuts through all the stats and grounds this problem in a way that's so real, so human. It's not about geography, it's about affordability.
So you might be asking, how did things get this bad? Well, the review really breaks it down into three core challenges, three big cracks in the system, and we're going to walk through each one, starting with maybe the most fundamental problem of all, access and equity.
You know, this slide just completely shatters the idea that being close to a hospital means you can get care. The barriers are huge, logistical, economic, you name it. And the review points directly to Georgia's decision not to expand Medicaid as a major reason for the high uninsured rates. But this last point, this is the one that's just absolutely devastating. Black women in Atlanta facing maternal mortality rates like those in some developing countries. I mean, that's not just a crack in the system, that's a chasm.
And it's not just about individuals trying to get care. The review makes it clear that the whole public health infrastructure itself is under some serious strain. The recent crises, they didn't really create these problems, they just ripped the Band-Aid off and showed everyone how fragile things really were.
And here you can see what that strain actually looks like. There's this massive gap between a federal giant like the CDC and the county services on the ground that are just chronically underfunded. Think about it. ERs have become the default mental health centers because there's nowhere else to go. And then, layered on top of all that, you've got environmental threats, air and water quality that are creating long-term health issues for whole communities. It's a system struggling on multiple fronts.
And again, Ariana Lyons brings it right back down to earth. This stuff isn't abstract policy talk. She says, it's daily life for kids in South Atlanta and seniors in Cobb County. These are the real-world consequences, you know? It's about the air a child breathes and whether a senior can get the care they need. It affects everyone.
Okay, so we've talked about access, we've talked about infrastructure, and now for the third piece of this crisis. The people, the actual healthcare workers who make the system run. And the review paints a pretty scary picture here, calling it a slow-motion collapse.
And it's not just one thing causing this, it's a perfect storm. Look at this breakdown. A huge chunk of it is just crushing burnout, 40%. Then you've got unsafe staffing ratios, stagnant pay, even bureaucratic headaches like inconsistent credentialing are adding to the strain. All these things together are creating a workforce that's just fragile, really, really fragile.
And the takeaway from all this? A really stark warning from Lyons. Atlanta is bleeding talent. I mean, that's pretty blunt. The risk is that without some major changes, the city's most essential hospitals, the safety net ones that serve the most vulnerable, could see a mass exodus of staff. And you can't run a hospital without people.
But after painting this really grim picture of the challenges, the review does something important. It pivots, because that's not the whole story. It turns out, amidst all this crisis, there's also an incredible source of hope and innovation.
Yeah, because for all its problems, Atlanta is also an engine for innovation. It's a proving ground for what the future of healthcare could actually look like. And this is where the story gets really interesting.
And you can see some of that incredible work right here. You've got these major innovation hubs like the Emory Innovation Group and Tech Square Labs. They're pioneering things like AI-driven diagnostics. And then you have really practical boots-on-the-ground solutions. Grady Hospital is using mobile health units to bring care right to people's doorsteps. And telehealth startups are jumping in to fill huge gaps, especially in mental health care. This is where the changes happen.
This quote just captures the whole spirit of it, doesn't it? The future of equitable care isn't only in hospital towers. It's in the hands of founders, nurses, and community health workers. It's not top-down. It's decentralized. It's focused on the community.
And it's being driven by a whole new generation of healthcare leaders.
Okay, so now that we have this full picture, the crisis on one side, the innovation on the other, the review doesn't just leave us there. It actually lays out a clear, actionable roadmap for the path forward. And here they are. 5 urgent priorities. It's a really comprehensive approach. First, the big policy one. Expand Medicaid. No surprise there. Then, take all that cool community and mobile care we just saw and scale it up. Number 3, demand transparency on environmental health issues. 4, you have to invest in the workforce, retention, safety, the whole 9 yards. And finally, number 5, hold everyone accountable with mandatory, data-driven equity audits. It tackles the problem from every angle.
And for the conclusion, the review zooms way out. It argues that Atlanta's story, well, it isn't just about Atlanta. It's really a mirror being held up to a challenge that the entire nation is facing.
Think about it. World-class hospitals surrounded by medical deserts, thriving innovation ecosystems right next to neighborhoods that don't even have an urgent care clinic. This is the fundamental conflict playing out in cities all over America, which makes what happens in Atlanta a really critical case study for all of us.
Which brings us to this final, incredibly powerful statement from Lyons. Health equity isn't a trend, it's a metric. And that just reframes the whole conversation, right? It's not some nice-to-have buzzword. It's a hard number. It's the standard by which we can actually measure if our healthcare system is succeeding or if it's failing the very people it's supposed to serve.
So, in the end, the review challenges the city to think bigger, not just about building better hospitals, but about building a better, more equitable system. And that leaves us with a pretty big question to think about for our own communities, doesn't it? When it's all said and done, how will our cities be judged?